Good morning.
Good morning.
How are you?
I'm a little tired, but I'm good.
All right, that's good to hear.
Okay.
My name is Lucretia, and I'll be a student nurse this morning. And can you give me your name and date of birth?
Melania Smith, October 1st, 1942.
Okay. This morning, before you have your breakfast, the doctor ordered you to take your levothyroxine medication to replace your thyroid hormone, and he ordered you to have 50 micrograms, which is going to be a half of a tablet. I'm going to compare this to my MAR. There you go, Miss Smith.
Okay.
And while you're taking your medication, I want you to be aware of some side effects. You might experience hyperthyroidism, and if you do, this is something you need to report to your doctor. And you will have signs such as tachycardia, which means your heart is going to be really fast. You may feel like palpitations in your chest, or your heart beating really, really hard. You will have some chest pain, some nervousness. You probably will sweat a lot. You're going to have some tremors, weight loss. If it's real hot, you're not going to be able to tolerate it. So whenever you see these symptoms appear, please contact your healthcare provider. Now, to monitor, to make sure we're giving you the right dose of Synthroid, we're going to check your blood and urine glucose, as well as your thyroid hormone, your T3 and T4 hormones.
Okay.
So make sure when you're taking this medication at home, you take it before breakfast. So you want to take it like 30 minutes to an hour before breakfast. And you do not take no other medication with it.
So how long will it be before I can take my other medicine after I take this right here on empty stomach?
30 minutes to an hour.
Oh, okay.
And make sure you do not take this medication with iron, calcium, magnesium, zinc.
Okay.
And just make sure you take your medication at the same time every day and don't miss a dose. Hey, Miss Smith.
How you doing?
Did you enjoy your breakfast?
It was all right.
Well, earlier we took your vital signs, and your heart rate was a 75, your respiration was 16, your temperature was 38 degrees Celsius, was like 100.4, so you are kind of running a fever, and your blood pressure was 136/95, and your blood glucose was 88. So your medication that we have to take now is a losartan potassium, also known as your Cozar, and this is your blood pressure medication. So based on your vital signs that we took early this morning, it's in range for you to take the medication. Okay? And this is for your hypertension. And I'm going to tell you about some side effects you should look for when on this medication. You might have a cough, or upper respiratory infection, some dizziness, some diarrhea, some back and leg pain, and you might also have some difficulties going to sleep. Now, if you overdose on this medication, you're going to have very low blood pressure. You might have swelling of the face, eyes, and lips. You might have difficulty swallowing and breathing. So if you experience any of those things, I want you to contact your healthcare provider, okay? To monitor this drug in your system, we're going to do a renal function test. We're going to also continue to monitor your blood pressure. We're going to always check your blood pressure before and 30 minutes after. We're also going to monitor you for hypertension, hyperkalemia, which means you're going to have a high potassium level. You might have an increased AST and an ALT, which are things that's related to your liver and how it functions. And you might have a decreased hemoglobin and hematocrit. Now, some things I want you to know while you're on this blood pressure medication is to always look for signs of infections. Avoid salt substitution.
So I can't use my no salt?
Well, you just want to make sure it's not a high level of potassium. And you don't want to take any potassium supplements. Ms. Smith, your next drug is anzetamide. Your doctor ordered 10 milligrams.
A lot of medicine.
And it inhibits your absorption of dietary calcium in the small intestines. And right now I'm preparing to get your MAR. Okay? And it doesn't matter if you take this with or without food. And some side effects of this medication is fatigue, dizziness, nausea, diarrhea, abdominal pain, chest pain, back pain, muscle and joint pain. Some labs and diagnostic tests that we will monitor while you are taking your ezetimibe would be assessing your lipid levels, such as your triglycerides and your cholesterol. We'll also do a liver function test periodically and as a baseline while you're taking this medication. Some things I want to teach you about the medication is some risk factors. Some things I want you to try to avoid is high-fat diets. I want you, if you are a smoker, I want you to try to stop smoking, stop using alcohol, and also start exercising. Okay, Ms. Smith, now we have your Lipitor, and this is your lipid lowering agent, and the doctor ordered 40 milligrams, which would be 2 tablets. And what this medication does, it helps lower your total and LDL cholesterol and your triglycerides. Now, some side effects of this medication, you're going to have some GI distress, which means you're going to have some stomach discomfort. You'll have indigestion. You'll have some diarrhea, constipation, gas. You might even have a headache and probably a liver dysfunction. You might have muscle pain as well. I also want you to report to your healthcare provider if you have any vision problems, and make sure that you're having an annual eye exam. Some labs that we might monitor while you're on Lipitor will be your serum cholesterol levels, as well as a liver function test for a baseline. And also, your physician, he might discontinue the medication if your liver function test increases 3 times than normal. Some things I would like to teach you about the medication, that I want you to stay hydrated. I want you to always take this medication with food, and I want you to try to reduce your cholesterol by reducing your fat intake and sugars. I want you to maintain a diet high in fiber, like whole grains and cereals. And I also want you to eat plenty of fruits and vegetables. And if you can, try to do a little more walking. Okay, Ms. Smith, are you ready for your other medication?
Yes, ma'am.
Okay, we have your hydrochlorothiazide, and this is a treatment for edema associated with congestive heart failure and hypertension, which increases your urine output. Your doctor ordered 12.5 milligrams, and this is going to be a half of a tablet. I'm going to check this against my MAR. Okay. Now, some side effects of this medication is you're going to have a low potassium level. You're going to have a low sodium level. You're also going to have high calcium level in your blood. And you might experience some dehydration because it makes you go to the bathroom a lot. And because of you urinating so much, you might feel some orthostatic hypertension. Like when you stand up, you might get dizzy. So I want you to be kind of cautious when getting up out the bed, like quickly. Mm-hmm. And when you do get up, I want you to kind of pace yourself at the end of the bed and then try to get up. But don't just get up and walk because you might fall. You might have some dizziness, like I was just saying, because your blood pressure might drop. And you might experience some weakness, some nausea and vomiting, or anorexia. Now, some life-threatening side effects I want you to be aware of is that if you see a rash, I want you to contact your healthcare professional immediately.
A rash where?
Anywhere. Like if you see bumps that you didn't have, because that's a reaction from the medication that your body's having. And this is Stevens-Johnson syndrome. I don't want to frighten you, but I just want you to be aware. Now, your physician, he will monitor certain labs and stuff when it comes to the medication. He's going to make sure he's paying good attention to your electrolytes, especially your potassium. He's going to check your blood glucose, your BUN, your serum creatinine, your uric acid levels before and during administration. And just by chance, you know, if they was to put you on like a lithium drug, it can increase the toxicity of other drugs. So you want to make sure you pay close attention to what you're taking and make sure your physician is aware that you are on this type of medication. And it can also decrease your effects of anti-diabetic agents because you are diabetic. Okay?
How I remember all this?
Well, the more we go, like the more you get the medication, you know, giving you information to take home, you discharge, you'll have it available. And if you have any questions, you can always contact us. I know it seems like there's a lot, it can be overwhelming, but the more you go over, the more you learn about your medication, you'll be more familiar with it. We don't expect you to learn all this overnight, but we are here as a source. Your next drug is dapagliflozin with metformin. And your doctor ordered 5 milligrams of dexamethasone with 50 milligrams of metformin. Okay? And that is 1 tablet. Hold on, make sure I prepare with my MAR. And this will help control your glucose levels with type 2 diabetes along with diet and exercise. Some side effects of this medication is general yeast infection, like a general yeast infection, common cold symptoms, a runny or stuffy nose, a sore throat, a UTI, diarrhea, a headache, flu symptoms, dizziness, cause constipation, and increased urination. Okay? Your doctor, he will monitor your glucose levels. He will also make sure he's paying attention to your B12 levels because this medication can decrease those levels. And if you have to do a radiologic study where they have to use some type of dye, make sure you let your healthcare provider know that you're on metformin because you will have to stop using it before and after you take your radiologic exam, okay?
Okay.
All right, and make sure when you're taking this pill, because I just observed you did not crush, chew, or spit that pill. You want to make sure you swallow it whole. All right, Ms. Smith, we have finished all your oral medication, and now we have your last, which is your injection. This is your Lovenox, and your doctor ordered 40 milligrams, which is equivalent to 0.4 milliliters. Okay? I have labeled this with the correct date, the time, the patient initials, as well as the right amount and what type of drug it is. I'm preparing it with my MAR. And this is your anticoagulant. Okay? This is basically your blood thinner. Now, you have a history of DVT, which is deep vein thrombosis, and this is going to help prevent those blood clots from forming. Okay?
Okay.
Ms. Smith, I'm going to give you this injection in your abdomen, okay? It's going to be 2 inches away from your belly button.
Okay.
You can always, if you're at home, you prefer a different side, you can give it in your thigh. You can give it behind your arm as well.
I can't reach back there.
Right, you might need somebody to assist you with that, but for today, we're going to do your abdomen. We're going to do 2 inches away. All right. You want to make sure that you're rotating the site. And then you can rotate the location every week. Like if you do this week, you do the abdomen. Next week, you can do your upper arm at the back. Let me give you your injection. Wiping out with alcohol. Letting it dry. And this syringe is a 27 gauge. And it's the needle length is 1/2 of an inch. 10 seconds has
Wait a minute now. Okay.
All right, let me know.
Let me breathe. Sorry.
You ready? All right, 90-degree angle. All right. Put this in the sharp container. I'm going to add pressure. Now, when you're on these blood thinners, I want you to make sure that you use a soft bristle toothbrush because you don't want the gum bleeding. Like, if you get any kind of cuts, it might bleed longer than what it normally would bleed. So you have to make sure you're being real careful. I want you to use, if you have to, electric razors. I want you to report any signs of bleeding to your doctor.
Electric razors. What's electric razors for?
It helps prevent cuts.
Okay.
We're trying to prevent you from getting cuts, period. We don't want nothing to bleed.
Right.
And if you do see any bleeding, please contact your healthcare provider because this is a blood thinner. So you don't really have the clotting factor that you normally used to have. Okay. Your doctor, he will monitor your PTT. It's usually 1.5 to 2.5 seconds. And he'll monitor your platelets, your hematocrit. He'll do a complete blood count. And then he'll also monitor for like different signs and symptoms of bleeding. Make sure you let your doctor know if you have any tarry stool, which would be like dark colored stool, which means that you got blood in your stool. And you also want to wear like an identification bracelet just in case something do happen to you. You want them to know that you are on this Lovenox. So if it's an emergency, they'll know what's going on, what type of care to provide you. Also, avoid garlic, ginger, ginkgo, and ginseng. They increase bleeding. So make sure you don't eat those. Well, Ms. Smith, that is all your medication for today.